In this episode of Leadership in Digital Health, I'm talking to Richard Strong, Executive Vice President of dbMotion, part of the Altera Health Group. We talk about what dbMotion is and its role as a health information exchange that's used in many countries across the globe, and how the aggregation of clinical data at the point of care assists in clinician satisfaction and clinical workflows. All right, well, thank you, Richard, for taking the time to join me today on our Leadership in Digital Health podcast series. One of the things that I really wanted to talk to you about was your solution, dbMotion, in the context of leadership in digital health. From the time that I've spent working with you in the past, I know that it's a solution that's based upon bringing together siloed collections of clinical data from various practice management systems or EHRs, and surfacing them in a consolidated way to provide a longitudinal patient record in context.
Absolutely.
Can you tell us a little bit about where dbMotion is used in the world?
Yeah, absolutely. So dbMotion is used in a number of different countries and with a variety of different use cases. So in the US, for example, we have a number of large organizations spread across the US. 30 to 40 organizations that are using the dbMotion solution to, as you said, surface information from multiple different systems in many cases. And actually now more and more are using it to find information from a much wider circle or geographical circle than they have historically been able to do within their own organizations. And we can talk a little bit about that. So that's the US. We've got a number of clients in Canada that are using dbMotion across provinces to, again, consolidate data from wherever within the province the patient might have been encountering the healthcare system, through to Israel, where the entire country of Israel is connected through dbMotion, more than 9 million patient records, all connected through every government hospital. There are 4 HMOs in Israel. Their data is consolidated through dbMotion, including Clalit, which is the second largest HMO in the world, through private hospitals, primary care physicians, military, everywhere that there's healthcare delivered in Israel is connected. In the UK, where we are right now, we're moving to integrated care systems, and we have dbMotion clients here that are using the solution to be able to connect primary care data and acute data, so wherever the patient is being seen, the clinicians have got access to that data. Through to Australia, where now we're working on our second state that we're implementing dbMotion, where we'll initially be connecting up pathology systems from across the state to surface that information in a consolidated way, aggregated in any care facility that needs access to those lab results across the state, and then gradually we'll be adding on EMR data and other solutions to bring that surfacing over time with more and more aggregation and more interoperability.
One of the things I've really always liked about the solution is the way that there's the emphasis on granular elements of data. The patient record in context is segmented into their list of conditions, their allergies, their procedures, their results, whereas a lot of clinical data repositories are document-based. Mm-hmm. And from a clinician's perspective, when you're asked to read through a lot of documents to try and distill a clinical picture, there's an additional cognitive burden there that sometimes it feels like the cost-benefit's not necessarily worth it. What proportion would you say of dbMotion instances are document-based versus that kind of granular data focus?
I think it really depends on what the purpose that was created in the first instance, but I think more and more, a much higher proportion is now granular. One of the big challenges with sharing data with interoperability is what's the point of doing it if you're not going to be able to get value from it? And the only way you get value from it is for the information to be actionable. So the more granular the data, the more actionable you can put, the more actions you can trigger from that. And as you said, reduce the clinician burden by not having to go searching for data. So I think more and more it's a higher proportion of our clients are really getting down into that granular level and storing data in a granular way. All of our clients do it, or pretty much all of them, but the percentage of the balance between documents and granular is moving much more towards granular. Having said that, in the US, particularly with the 2015 Cures Act and the information blocking rules that flow from that, we have connected through Care Quality to enable our clients to access, in effect, information from anywhere in the US. At the moment, the majority of that is document-based. So again, that gives a burden to the clinician. So what we've introduced is actually a functionality that enables keyword searching that will go into the documentation and pull out those keywords very quickly, so that the clinician isn't having to search through 30 pages of documentation to find the one word around diabetes or cardiomyopathy or whatever it might be. They can go search the terms and still take some action and reduce the burden on them to be finding a needle in a haystack.
I found that as a family member recently. One of my family was in hospital after having suffered a second stroke, and lots of questions which she wasn't really equipped to answer about what the first stroke was like, and in the kind of system you describe, those questions don't need to be asked over and over again of the patient anymore, because they're on record, whether they're in document form or otherwise. FHIR is really starting to hit its stride and take the interoperability conversation by storm. It's all about FHIR. Is that starting to make integrations easier than they used to be? How long has dbMotion been around, and has there been a change in how long it takes to get systems hooked up compared to how it used to be?
So dbMotion has really been around for more than 20 years. It was originally an innovation in Israel, and then was taken to the US with big investment from UPMC as an organisation in the US, and it's grown from there. I think as organisations have adopted standard integration methodology, it does become quicker and quicker to adopt. And as FHIR is becoming more and more universal, we are seeing it's even quicker. So I actually had a very recent interesting example where we were presenting at a conference with our client, and we had recently introduced FHIR Read into their environment, and about 2 weeks before the conference they turned on an integration through FHIR for a patient portal that they were working with. And during the presentation, they said, we just turned this on, and a second company they were working with said, oh, and by the way, 2 days ago, we turned on a second feed. And the client didn't even know it was fully live. It was a surprise to them, but it had been a very rapid implementation that they hadn't needed to monitor it every day because it was easy and straightforward with FHIR. So FHIR is absolutely speeding up the ability to integrate, for sure. But obviously with everything, it evolves and evolves. So that was with FHIR R4. We've now released FHIR R5 just in the last week or two, and that will bring its own challenges. There's other regulations we've got to comply with around bulk exports and these sorts of things. So it's a continuing evolution and will be for a long time.
Yeah, absolutely. Is there any focus on outcomes and benefits to patients as a result of dbMotion implementations?
Traditionally, the dbMotion implementations have really been focused on clinicians and the clinician usage. Obviously, indirectly, that will benefit patients. So, for example, in one of our clients, they surveyed their clinicians, and a majority of those clinicians said that they had changed the clinical treatment pathway they were going to follow, having been able to access dbMotion information about something about the patient from wider than just their health system. They changed their course of treatment or the clinical decisions they were making, and that obviously should improve the outcome for the patient, because they based it on more information. I think, so that's not directly the patient, but by implication is, what we are seeing more and more now is, though, obviously with the rise of things like personal health records, the ability to hook into dbMotion is now something we're being asked for more and more and are starting to do. And in effect, the patient is just another user of the system which has a unique role, and they only have access to one patient's information, but they can see the information compiled together, and they don't have to go into multiple different primary care providers, local hospitals, into each individual portal to see their combined information, and they can see the latest and greatest. So I think in terms of benefits of seeing a holistic record, a virtual longitudinal record, without actually having to store it anywhere themselves, they will be able to get a much better picture of their own health.
So on the back of the work that's done by dbMotion to aggregate and harmonise many different systems, it actually enables even further consolidation thereafter to kind of larger scale.
Yeah, absolutely. And of course that brings its own challenges, right? So the more systems that you're bringing together, the more challenges you've got about oversharing, duplication of sharing, making sure that you're only seeing one set of correct data, that that data is actionable, but that you're not getting multiple alerts from different systems that aren't consolidated. So these are sorts of challenges that, as you do more interoperability, the more you have to think about those sorts of things.
Yep. And does dbMotion offer an interoperability ecosystem that other solutions can tack onto?
Absolutely, and that can be bidirectional. Absolutely. So we have our own SDK, our own software developer kit that any third-party company can hook into in order to read or write data into or out of the database, obviously with appropriate authentication, authorization, all that sort of stuff. So yes, we do, and we have a number of companies that do that. And in addition to that, we also have functionality if the systems connecting in have the capability, and all the big EMR vendors do, for example, where a user seeing some data in dbMotion that's been generated somewhere else, they have the opportunity to be able to bring that data into their own EMR. And then it gets consolidated as part of the record, and it gets identified as having come from the original source, etc. One of the benefits of doing that through dbMotion is when it's generated in one system, it may be coded in one way. In dbMotion, it's normalized, and when it's brought into another EMR from dbMotion, it's brought in the coding system that EMR knows it, even though it may have been generated in a different one.
Yep. So you've added that semantic interoperability.
Exactly.
And then you've added that provenance as well, so you know where the data has come from.
Absolutely. Yeah, the source provenance and all of those things, source coding systems, etc. But it's displayed in that source, or stored in that new system in the way they know it.
Yeah. So I mean, with your solution, by definition, being part of an information network, partnership must be a really important factor in the success of every initiative. What do you think underlies the most successful partnerships that you've seen in dbMotion? What kinds of qualities, what kinds of company culture and vision?
A lot of people might say that it's, conforming to standards and all of that sort of thing. Actually, it's not. It's about relationship. It's about communication. It's about wanting a single outcome. You want the same outcome for your clients, for their patients, for their clinicians. It's about co-opetition, if you like. It's not competing with each other. We know what we do well. We know there are lots of things that other companies can do better, and if we work collaboratively, the outcome for the clients, for their clinicians, and ultimately the patients is going to be better. So it's all about single shared vision, collaboration, and a mindset of getting stuff done rather than putting barriers up. Just moving the barriers aside to get the right outcomes quickly.
I really love that, because it doesn't have to be a zero-sum game where for one solution to succeed, another one has to miss out. I think we're all ideally looking to lift the industry together.
Yeah.
And we see across the world that healthcare systems are under pressure with more volume and more to do, often with less, and technology really needs to play an important part in that. And so that co-opetition that you refer to, I think is a really essential ingredient.
Yeah, absolutely. And we saw, certainly in the UK, during COVID, all of the suppliers really work well together. And some of that moved back after we came out of the pandemic. But actually, I think a lot of it's still there. There's still that mindset of you can achieve so much if you work together. You can do it more quickly, higher quality, and with the right outcomes. So hopefully, we'll see more and more of that as we move forward, and we won't go back to a lot of that mindset of being we're the only people that can do this for the client, and we're not going to work together and collaborate. And I think the cat's out of the bag, or Pandora's box has been opened, or whatever. Now I think the healthcare organisations realise what can be achieved if people work together, and so they're fostering those relationships.
Yeah, and it's setting up those conditions for success, incentivising cooperation and partnership, and rewarding it.
Exactly.
Yeah. So we've talked a little bit about the clinician experience. To flip it around to the other side and talk about analytics level views and performance across the enterprise and increased visibility of trends and load upon the system. Does dbMotion help with that?
dbMotion certainly helps with it, but I don't think it's the answer to it. So, dbMotion, obviously we have a very deep and rich repository of harmonised, normalised data, and we have extracts and analytics capabilities to sit across that. And we've built and are sort of testing and working through challenges around a sort of an AI ML platform that sits over the top of it to have insights and recommendations in real time. But I think the challenge for me of true analytics, particularly when you get to predictive analytics, is we really focus on clinical data. To really be effective, you need financial data, a lot more admin data, you need environmental data. And where does that sit? Who owns that? And where's the right place to plug that in? We work with provinces, we work with large health systems, we work with countries in some cases. But like I say, we mainly focus on the clinical data, and bringing all the other elements of it together is typically done in an enterprise level with a data lake, data warehouses, etc. So we contribute to that. We can absolutely support it and help it, but I don't think it's a complete picture and the complete answer.
Mm-hmm. Is data governance and data management policy often a barrier to those kinds of efforts, or are you finding that that's getting easier?
It can be a barrier, absolutely, and we know in many countries that there's been failed efforts to really move forward with this because of bad handling of data governance. So certainly the opt-out model of consent is much more successful typically in our experience than opt-in. You get a small number of people opt-in, but equally in an opt-out model, you get a small number of people opt-out, and therefore, you get over those quite quickly. If you going back to the question about partnership and cooperation, if you've got health systems and suppliers that all want the same outcome, then you typically can get data governance and data sharing agreements done fairly well, fairly quickly. If they're not aligned and don't have the same outcome, they can absolutely cause major challenges with sharing data.
So looking forward across the next few years in our industry, it's going to be a particularly exciting time. New technologies and approaches are coming to bear.
Yep.
Interoperability is taking hold, and it's interoperability with purpose rather than just as a means to an end, rather than being the end in itself. What are the innovations that you'd like to see, or if you could snap your fingers and achieve a leap forward in a short space of time? What would you like to see for our industry?
That's a really, really good question. I mean, I think personally, I'm a great believer in things like artificial intelligence, machine learning, and so I think we're going to see a lot more of that. I think really moving away from just single repositories and getting more towards a virtual longitudinal patient record with federated environments that with very quick response rates. But most importantly, I think getting to that active or proactive stage of predictive analytics, providing cues to the clinicians in real time based on data that's been aggregated from across the continuum of care, complete continuum of care, is where we need to get to. Leveraging technology advancements as they go. I'd love to be able to click my fingers and say technology debt has gone. You know, we're using the latest and greatest, and we'll always be with the latest and greatest. But that's not reality. So moving to systems that are architected in a way that can continuously evolve quickly. You know, moving away from the classic things like, you know, big app upgrades that take a lot of time and effort from us and from the clients to, you know, that sort of continuous implementation, continuous delivery type of approach of just turning things on, never having downtime, having stuff in real time.
Yeah, I couldn't agree more. You know, the availability of having zero downtime upgrades. You know, we're used to the apps on our phone as consumers, you know, doing all that stuff in the background, but you know, we're not there yet in digital healthcare, are we?
We're not, but you know, there's a good second point that comes from that. What I'd also like to see is the solutions that we're providing and others are providing as intuitive as apps are. Well, I don't think we're ever going to get fully to a point where everything's fully functional within an app. But if you can put it in a tablet or a laptop or wherever, and the first time someone uses it, they understand how to use it. If we can get to that'll be a major step forward.
Yeah, I think that's a tremendous aspiration. We put our devices in the hands of our kids and away they go. Being able to do that, no matter which healthcare institution you turn up to work at on a Monday morning, and just be able to hit the ground running would certainly be a great ideal.
Yeah, absolutely.
Wonderful. Well, thank you very much for talking to me today.
No, thank you. It's been great.
Wonderful. So interoperability has been a strategic imperative in digital healthcare for a long time now. In recent years, that's largely been driven by regulatory requirements, and the technology is being brought to bear to meet those. What I'm struck by in my conversation with Richard is that dbMotion has been in the interoperability game for a very long time, and it's been driven by clinical outcomes to present a longitudinal patient record for clinical review to assist in the diagnosis and management of patients. And so I was very impressed by the emphasis on partnership to achieve those outcomes, and what can be achieved when all stakeholders are aligned and the technology is in place to achieve those defined objectives.